Hi, I'm Dr. Newman, and this is Your Voice. Good evening, and let's get on with it. So, if you haven't already figured out what we're going to be doing, we're talking about politics. No, we are not. We're discussing anxiety. Politics can cause a lot of anxiety, especially with what's going on nowadays, but nevertheless, anxiety is an interesting experience. And let me say this, of all the things that I deal with day to day, of all the patients that I see day to day, probably anxiety is the most prevalent. Most people, when addressing their issues, whether it be depression, grief, whatever it might be, there always seems to be a component of anxiety that's involved in their presentation. Some people just come to me and say, I'm anxious as hell. I don't know what to do about it. I can't sleep. I can't eat. I can't go out. I don't know what I'm doing. I can't think straight. A whole bunch of things. So do I treat anxiety as a disorder in and of itself? No. First, what I do is examine whether or not anxiety is an extension of something else that may be going on. I think that's important to determine before treating it. Anxiety as well. I know you're going to be surprised when I say this, but let me say it anyway. It's your best friend. It's kind of hardwired in us, isn't it? Anxiety is hardwired in us because way back during the period of time when I was born, kidding, back in the Stone Age, the folks that encountered, you might say, a saber-toothed tiger and went down and said, good kitty, no longer are with us. Those folks that climbed the tree and looked down and said, hey, what's Joe doing? Passed on their progeny and their genetics and everything else with that to us. So it is a part of who we are. It keeps us safe, doesn't it? It keeps us from running around in traffic on a freeway. It keeps us from doing really stupid stuff. It doesn't allow us, well, most of us, to walk down a dark alleyway with a bunch of $100 bills hanging out of our pocket, inebriated, heading towards wherever our car may be. That is just flat out dumb. And it says, don't do this. Now, of course, when we're inebriated, our good judgment flies right out the window and we pay no attention to it, right? A lot of people do self-medicate, especially when they are experiencing anxiety with alcohol and a lot of other things, just to calm themselves down. I get that. It takes the burden off our shoulders. It allows us to relax. That's fine. But never forget the fact that anxiety does keep you safe. It does protect you. Now, the problem with it is if anxiety is, you might say, out of control and it has exploded and gone nuclear, your good judgment is also out the window. In other words, the anxiety so overpowers your good cognitive functioning that it doesn't allow you to put handcuffs on the anxiety and say, listen, you need to back off, chill out, sit down, and let me handle this. I've done this before. I don't need your help. Anxiety is kind of like your best friend who's a backseat driver and sitting back there mouthing off constantly, telling you where to make the turn, put the brakes on, go slower, watch out for the truck. Oops, there's a red light. Oops, there's a stop sign. What do you want to do? You want to turn around and smack him in the back of the head. Well, if your good judgment is intact, you can do the same thing. And what that takes is basically a shift in your perceptions. What is it that you're actually looking at? What is it that you're actually fantasizing about? Because what is anxiety? Anxiety is nothing more than a fear of the future. In other words, you are basically fantasizing out in front, thinking about what may happen to you. What if this happens? What if this doesn't happen? And you begin to create this seed of worry, which then manifests itself and grows into a huge oak. One of the best ways of dealing with anxiety is to keep the future present. In other words, look at what's going on around you right now and enjoy exactly what's happening rather than stepping out forward. Because when you step out forward, you really don't know what's going to happen. You have no idea what the future may hold. So do you worry about it? Yeah. Do you put in precautions? Do you set up a plan that says, I'm going to try to minimize my risk? That's good cognitive functioning. That makes perfect sense. But if you begin to worry about the what ifs before they even take place, that's going to paralyze you. Some of the best treatment around for anxiety, so to speak, is CBT. Most of you may be familiar with it. CBT is an acronym for cognitive behavioral therapy. It's been around for a long, long time. And what it basically does is it allows you to shift some of the things that you've been fantasizing about and some of the things that you may be encountering to a different perspective, allowing your behavior to take better control of the situation and learn how to calm yourself down in those situations. Does it work? Yeah, it works. Does it take a little bit of time to master it? It does. Nevertheless, if anxiety is an extension of another issue, cognitive behavioral therapy may not be the best thing for you. Now, let's put it in this perspective. Let's say, for instance, you're dealing with, here's a good one. Let's say you've got ADHD, which is attention deficit hyperactivity disorder. And along with it, you're suffering with anxiety. What do you've got? Have you got ADHD and anxiety? Yeah. Or do you have ADHD, which is basically the main diagnosis and an extension of anxiety off of the ADHD? That's a good possibility because people who have attention deficit disorder have a very difficult time keeping things in line. They have a very difficult time organizing themselves. They forget to pay things. They forget where they put their keys. They don't hear everything they're supposed to be hearing because they're distracted. And because of this, their life's a bit tumultuous. When your life is tumultuous, is it in order? No. Does it create anxiety? Yes. So in that case, if we're treating the attention deficit disorder and your life becomes much more manageable, what happens to anxiety? Forwards, because your life is now organized. And when your life is organized, there's less to worry about. The pure general anxiety disorder does exist. People do travel around fearful of any number of things. And one of the ways of dealing this, as I mentioned earlier, is cognitive behavioral therapy. The other way, of course, is medication. And there are a number of medications that can be utilized for anxiety, which I will get into in a minute. But I want to add one more thing. Anxiety can also be manifested from physical issues. In other words, let's say, for instance, you have a thyroid condition. If you have a thyroid condition, yes, it can create issues of anxiety and depression and other issues that may mimic mental health issues. So keep that in mind as well. And people that have been through a number of medical problems, whether they be surgery or cardiac things and so on and so forth, will typically have anxiety about some of the things that they are going through. And that's a pretty normal issue. But once again, when it's out of control, it does disable people. It makes life very difficult. Some of the medications, which I was going to mention a minute ago, include things like the benzodiazepines. And that's a family of medication that a lot of people are familiar with. And if I throw a couple of names out, you probably recognize them, such as Xanax and Ativan and Valium and some of these others. These medications do work. They have a very interesting side effect profile. I hate to use the word side effect, but let me just say they have interesting character traits as a medication. They work. The issue with them, though, is one, they are highly addictive, and to use them for an extended period of time is not really the best standard of care. The reason for that is because, as I had mentioned, they're highly addicting. And as you continue to use them, of course, you become dependent on them. And the longer you use them, you end up building a tolerance towards this medication. And what I mean by that is, let's say, for instance, your doctor decides to put you on, for the sake of argument, say Xanax, and you take a 0.5 milligram. And you're taking that now for a year, maybe a year and a half. Then all of a sudden you take the medication and guess what? It doesn't work because you've built a tolerance towards this medication. So what do? You pick up the phone, you go, "Doc, what are you doing? The medication doesn't work anymore. What am I supposed to do?" Doctor says, "Come on into my office. Let's sit down and have a chat." Okay, very good. Well, some doctors will say, "Let me look really good in front of you. Let me write you another prescription. Here's one for 1 milligram of Xanax. You'll be good to go. See you later. Call me in a month." Does it work? Yeah, it works. You've just jacked the dose up, and now it's working because you built a tolerance against that 0.5 milligrams of Xanax. Now the 1 milligram is working. But guess what? A year from now, will that work? No. You'll build a tolerance to that 1 milligram, and guess what? In the doctor's wisdom and an attempt to make a couple of bucks, and I am a physician, I can say this. They could very well go ahead and jack that dose up again. And that is not in your best interest. It's not a good idea to do this. Benzos are used for short-term patches. They're used to help people get over a hump, to get over some turbulence in their life. That's how they should be used. Long-term, not a good idea. Some of the other side effects of the benzos include things like memory loss. If you use it long enough, your memory will start looking like Swiss cheese. You'll forget where you put your keys. You'll forget who you're supposed to be calling. You'll forget what it was you went into the supermarket to purchase, etc., etc., etc. And you don't want to go through life like that. It's not a good idea. The other thing that benzos do is they will reduce your ability to breathe. They are basically a respiratory depressant. And the issue with that is it gets worse when you combine it with other medications. Pain medications are notorious for having a bad outcome when mixed with benzos. Keep all these things in mind, please. If you are prescribed a benzo, as I mentioned some of the names earlier, like Xanax, Ativan, clonazepam, some of the others like Valium and so on, make sure you use them judiciously. Use good common sense. If you can get off them, get off them. One of the other medications that can be used for anxiety, and of course they are much safer, are some of the antidepressants, some of the older SSRIs, which are specific serotonin reuptake inhibitors. Those are the ones you're familiar with. They've been around for a long, long time, some of them. Throw a couple of names out for you. One of them is Prozac, of course. You're very familiar with that. It's been around quite some time. Escitalopram, which is Lexapro. You've got Zoloft. You've got a bunch of them out there. They've been around for years. And when taking them, of course, they don't act as fast as some of the benzos do. But if you stick with it, you hang in there for about a month or so, those medications will start settling in, and you will find some balance in your life. And that anxiety could very well get under control to the point where your good cognitive functioning takes hold, and you can overcome your anxiety. One of the other medications that's out there is called Buspirone. It's the trade name for it is Buspar, and Buspar comes in a lot of different doses. It has some serotonin effects. You can take that medication 2 or 3 times a day, and that will also help you reduce your anxiety over time. Again, it takes a little bit of time, 3 to 4 weeks or so, and you'll start to feel it take its effects. That is not addicting. It has no dependency issues, and you don't necessarily build a tolerance to it. The SSRIs, the old antidepressants, and the Buspirone, their side effect profile is very, very minimal. Talk to your doctor, have a conversation with your doctor, and figure out what's the best course of action for dealing with this issue. As I mentioned earlier, if you can track down a therapist and sit down and go through some cognitive behavioral therapy, of course, that's going to be the safest and longest acting of your treatment regimens. It does take a little while, but you're going to build up some new skills, and those skills will stay with you the rest of your life. And hopefully, if you are taking medication and you do track down the therapist and do some CBT, both the medication and your cognitive behavioral therapy will work better together than one alone. If you are having difficulty sleeping due to anxiety, there are options to assist you with that. And once again, you might want to start considering things like calm meditation. Also, make sure that you maintain really good sleep hygiene while you're at it. What I mean by that is make sure that you go to bed at a reasonable hour every night and do that consistently. Make it a habit. Make sure you allow yourself 7-8 hours of sleep. Make sure you expose yourself to the sun in the morning, because it is a trigger mechanism for adjusting your sleep cycle, which is called a circadian rhythm. That will help you maintain better sleep for yourself. Good sleep can also help reduce anxiety because you're not tired, you're not emotional, and you're not on edge. So all of these things can be very, very helpful. If, by the way, you have any questions regarding anxiety, if you have any experiences suffering from anxiety, or you know people that do, please feel free to give us a call. The phone number is right there on the screen. We'll be around here to take your calls, and we're happy to put you on the air and allow you to articulate whatever it is that's on your mind, and maybe share with us some of the things that you've been through and how you resolved them. So with that being said, we would like to continue this, except I am running out of steam, and it's very hard for me to sit here and talk to myself, by myself. It's pretty difficult, actually. But it seems like we're doing pretty good. Let's talk a little bit about some of the outcomes or complications, you might say is a better word, of anxiety. Some of you may have experienced one time or another what might be called a panic attack. A panic attack or panic disorder is an interesting phenomenon that comes out of anxiety. And it feels scary. It feels as if you might be having a cardiac event or a heart attack, you might say. What ends up happening, it's a terrorist attack. It can happen anytime, anywhere, under any circumstances or events. There is no predisposed trigger, you might say, for a panic disorder. It's, like I said, a terrorist attack. And what ends up happening is you end up experiencing some very interesting physiological symptoms, such as racing heart, palpitations, sweating, trembling, feeling faint, feeling nauseous, feeling, they use this term a lot, kind of a sense of doom. In other words, you feel as if you're going to die. And that is a very unsettling experience. What happens is that you get this fluttering in your heart, or your respiration starts to kick up. That physiological trigger can cause a domino effect, which then leads to full-blown panic, where you just want to get up and run the hell out of there, wherever it is. You just want to take off and disappear. This can happen in a department store, it can happen in your car, it can happen walking down the street, or playing the 18th hole of a very beautiful golf course. It doesn't matter. It lasts somewhere around, I'd say anywhere between 10 to 20 minutes or so, and then it can disappear. But during that period of time, you're not quite sure what's going on, and it's pretty scary. One of the issues with that is that a lot of people end up in the emergency room because they do believe that they're having a cardiac event. And then when they get there, they do your EKG and they do a full exam on you and they say, nope, you had a panic attack. And you go, what? Had a panic attack? I felt like I was dying. And they go, yeah, I know, that's what it feels like. So here you go. Why don't you take one of these? We'll give you 3 or 4 of them and use it if you have a problem. What they probably give you? They probably gave you a benzo. And that is your little fire extinguisher to put out the panic attack if it happens again. Now, the interesting thing, too, is that, let's say, for instance, you're walking through, I don't know, I'm not advertising. Let's say you're in Target and you're walking down an aisle and all of a sudden you feel that little flutter in your heart, the dominoes begin to fall, and now you want to run like hell outside at a Target because you feel like you're going to die. 10 minutes later, you feel better, you're in the car, you're breathing heavy, the sweat's pouring off your forehead, and you're going, wow, what was that? Well, you're cool. You leave, you go home, you chill out for a while. You now associate your panic attack with what? Target. The truth of the matter is, it has nothing to do with your panic attack. But now you've associated Target with your panic attack. Do you want to go back to Target? No, because you're scared you're going to have a panic attack again. What is that? That is anxiety. There is no truth to the fact that if you go back into Target, you're going to have a panic attack. It has nothing to do with it at all. So keep that in mind next time you run into a situation like this, okay? And understand that there is absolutely no correlation between the two of them. Lots of people have anxiety when it comes to social situations. In other words, they have what may be called like a little social phobia. And they don't like being out in groups. They get uncomfortable with them. They don't like going to crowded places and so on. So there's a lot of phobias, of course. But one of the more popular ones, of course, is social phobia and performance anxiety. Little known fact that there is a low-dose, interesting medication called propranolol, which is used by a number of folks, including celebrities and certain athletes, to keep them calm and collected when they are performing. In other words, what it does is it controls those physiological symptoms of social phobia and performance anxiety. So remember the symptoms I mentioned about when people have a panic attack. Remember that flutter in the heart, the increased respirations, the trembling, the sweating, and all that kind of stuff? Well, this medication actually gets some of that under control without affecting cognitive functioning or making you necessarily tired. So it's a perfect tool, you might say, for those people that have to perform in front of large groups and they're having a bit of stage fright, you might say. They take medication like this, maybe 30 minutes before they go on stage, things settle down, heart rate is under control, their voice doesn't get all constricted, they don't shake, no one sees them sweat, they look cool and calm, like belong on stage. And this medication does help. So some people who do have these kinds of issues like social phobia or performance anxiety carry a little bit of propranolol around with them in their either their man bag or their purse or something, and then pop one when they need it, and off they go. And they perform as well as they possibly can, and they use this sometimes. Of course, there's other methods other than that, but that's just a little tidbit I wanted to pass on to you guys. I hope you get something out of this, and I hope you've enjoyed sitting here listening to me rattle off this nonsense. But I do hope that it helps. And if it does help, pass this on to someone that you think might need it. If you enjoyed what you heard, hit the subscribe button. And once again, we will be back and talk some more about other interesting topics. If you have any suggestions at all, please pass them on to me, either by text or giving us a call. And I'd love to be able to attend to any of your questions or concerns. Take good care of yourself, and we'll see you in about 1 week.